Public health has taken center stage over the last few years, and for good reason. Our health as a global community impacts so very much of our livelihoods. And with the most recent pandemic, China's healthcare system has been the topic of a lot of discussion. So let's take a look at China's public health infrastructure, the largest medical system in the world. China's main health indicators rank in the top among middle and high-income countries. And the average life expectancy in China is getting longer and longer, from 68 years in the 1970s to over 78 years old today. It's expected to exceed 80 years by 2035. But historically, going to the doctor wasn't necessarily a common occurrence in China. For many years, the country lacked quality medical care and modern medicines that play a huge role in increasing life expectancy and general public health. In the 1960s and 70s, the overall quality of life in China wasn't high, and it was often difficult to find a doctor. It was also challenging for villagers in remote areas to get to hospitals because of the long distances and large expenses. To fill the gap, so-called barefoot doctors would walk through the streets of villages with their medicine boxes to provide diagnosis and treatments. But these barefoot doctors only had simple medical training, so couldn't always provide the care that was needed. When China began to reform and open up to the rest of the world, the country also experienced new development in its economy and society. With this came an increased demand for medical services, which led to the state increasing investment in medical care. Since then, the public health system and medical service systems have improved at rapid levels. But just how far has China's healthcare system come? In the last 50 years alone, the total number of national medical and health institutions has increased from 170,000 to more than 1 million. The number of doctors has increased from 1.8 million to over 4 million, and the total annual health expenditure has increased from 11 billion to 7 trillion yuan. China has worked to establish a medical insurance system aimed at covering its entire population. The number of people participating in basic medical insurance has reached more than 1.3 billion, and the coverage rate has exceeded 95%. Through their triple protection system of basic medical insurance, serious illness insurance, and medical assistance, the burden of medical expenses for common and chronic diseases and serious illnesses have been reduced, and poverty due to illness is being eradicated. China has continuously increased investment in public health to work towards controlling the prevalence and spread of infectious diseases. But their health infrastructure has been tested significantly during the pandemic outbreak, challenging the strength of their medical community. And while there's still improvement to be made within their healthcare system, along with much-needed recovery from the challenges presented by COVID-19, China's medical services are working to lay the foundation for a healthier country and people. As many countries continue to recover from years of pandemic, leaders and neighbors alike look to public health efforts to build a better future. For more stories, follow us online at The China Current.